Good afternoon. Thank you again to everyone listening to these briefings each day. I want to thank you. We know that this is a challenging and uncertain time for the state and the nation. Our current way of life has been put on hold, but I want to assure you that there is hope. Since January, we have been preparing for this, and we had a plan, and we're implementing that plan. I also told you that communication is critical at all times, but especially during the times of crisis, and we appreciate Missourians taking the time to stay informed. As of 2 p.m. today, there has been 838 positive cases of COVID-19, including 10 deaths. A tremendous amount of work has been accomplished in just a short period of time. In just 2 weeks, I have signed 5 executive orders to assist the COVID-19 response. We have waived and suspended nearly 170 state statutes and regulations and have ordered statewide social distancing. We have approved the purchase of $10 million worth of PPE. Just this morning, I was out at the warehouse, and we got to see firsthand all the supplies we're receiving and shipping out each day. We have requested and have been approved for a federal major disaster declaration in the state of Missouri. We have mobilized the Missouri National Guard to further assist our efforts. And it doesn't stop here. I want Missourians to know that we are and will continue to do everything in our power to respond to this crisis and support them in every way possible. As we all know, PPE is a concern, and Director Carson is here today to provide an update from the Department of Public Safety. Director?
Thank you, Governor Parson, and good afternoon, everyone. Thank you for joining us. For the last 2 weeks, I've been addressing PPE, personal protective equipment, at these briefings, in discussions with local officials, and in conversations with first responders. PPE is on everyone's mind because it's so important to protecting medical personnel and first responders from the coronavirus. PPE masks, gowns, gloves, and face shields don't just protect the people wearing them. It's really about protecting all of us. If healthcare providers or first responders and EMS personnel become infected with COVID-19, they're at risk of spreading the virus to others, to their families, and to the people they work with. And if first responders and medical personnel become infected, that reduces the number of people there are available to serve Missourians. We're all at a higher risk, and community transmission continues across Missouri communities. This morning, Governor Parson and I toured the SEMA warehouse and witnessed the multi-agency efforts taking place to expedite shipments of these supplies to our colleagues and partners across Missouri. Teams from the Department of Public Safety, the State Emergency Management Agency, the Highway Patrol, the Division of Fire Safety, the Department of Health and Senior Services, MoDOT, and the Office of Administration are all involved in this important task. We continue to ship PPE from the Strategic National Stockpile to hospitals, to healthcare providers, to EMS, long-term care facilities, and others eligible to receive PPE from this source. To date, we have shipped more than 4,074 total cases of masks, surgical gowns, gloves, and other PPE items. On Thursday, our Missouri Strategic National Stockpile warehouse shipped 39,000 N95 masks, 16,000 surgical gowns, 13,700 face shields, and 5,600 surgical masks. Just yesterday, we shipped 148,000 N95 masks, 1,700 surgical gowns, 7,800 face shields, and 58,200 masks, surgical masks, that is. These supplies are being sent to departments and hospitals of all sizes in rural and urban areas across the state. For our first responders, just yesterday, 5 pallets of PPE were shipped to various agencies in our state. As shipments continue to arrive, prompt distribution of these important supplies to our first responders remains a top priority. Equally important are the orders for PPE. We continue to place those on a regular basis. Just yesterday, orders were placed for over $15 million worth of PPE. We expect delivery of those items to begin next Friday. We know first responders on the front lines are working hard to protect Missourians during this crisis. Another priority is keeping them safe and healthy. We're grateful the Missouri Department of Health and Senior Services is now expediting COVID-19 testing and test results for first responders and other public health and safety professionals by processing their specimens directly through the Missouri State Public Health Lab. This means frontline responders who've had close contact with suspected COVID-19 patients and subsequently experienced symptoms such as fever, cough, or shortness of breath will be given priority testing. Again, this testing will occur if you meet 2 criteria: close contact with a COVID-19 patient and exhibiting symptoms. Those responders who test negative and recover from their symptoms may return to work sooner and continue providing critical services to our fellow Missourians. Finally, while we're all fighting the coronavirus, I want you to know we continue to keep track of severe weather and other potential risks. Last night, severe storms tracked across much of the state, and large hail left a trail of destruction. Severe weather is again in the forecast for much of Missouri this evening and tonight. Even as Missourians take on the challenge of COVID-19, it's important to be alert for severe weather and have a plan in place. Follow your local forecasts and take action if there becomes an immediate life safety threat. Please be ready and know how you will keep your family safe. In conclusion, I want to say a special thanks to all those teams working long hours to assist with this situation. We're doing things at a faster pace and a bigger scale than many of us imagined. We're dealing with large quantities. We are problem solving together. We are working to address the daily challenges this situation brings, and together we are serving Missourians. Thank you.
Thank you, Director, for the update. On a personal note today, first let me just say this. To the people and the reporters that do nothing but criticize others, you don't listen. You don't need to listen anymore to this briefing today, because there's nothing I'm going to say is going to pertain to you. However, for the hardworking Missourians, the people who are out on the front line, people like the doctors, the nurses, and our first responders, public health care professionals, the law enforcement officers, the firefighters, the EMTs, the truck drivers, the factory workers, the food chain workers, the grocery store clerks, the convenience store workers, the prison guards, the daycare workers, the teachers, the clergy, the mental health providers, and the media that report the truth, to the workers that still go to work every day, and to the Missouri citizens that are following the orders and doing what they're asked to do. This reminds me of who we really are as Missourians. In 1910, President Roosevelt made a speech, and a portion of that speech was called The Man in the Arena. And I'd like to dedicate that to the people of this great state, the people who are doing what they're asked to do for the people that are on the front line. It is not the critic who counts, not the man or woman who points out how the strong man or woman stumbles, or where the doer of deeds could have done them better. The credit belongs to the man and the woman who is actually in the arena, whose face is marred by dust and sweat and blood, who strives valiantly, who errs, who comes short again and again. Because there is no effort without error and shortcoming. But who does actually strive to do the deeds? Who knows great enthusiasms, the great devotions? Who spends himself or herself in a worthy cause? Who at the best knows in the end the triumph of high achievements? And who at the worst, if he or she fails, at least fails while daring greatly, so that his or her place shall never be with those cold and timid souls who neither know victory nor defeat. God bless you, and God bless this great state of Missouri. Kelly, you have some questions today?
I do. I have a couple questions first for Dr. Williams. Dr. Williams, this is from Jennifer Moore, KSMU Ozark Public Radio. The CDC's website said it provides guidelines for testing, but, quote, decisions about COVID-19 testing are at the discretion of state and local health departments. In Missouri, how much discretion is given to county health departments to decide who is priority tested at this time?
With our new guidelines on Monday, an intent is clearly to push out the decision on who is tested, especially in nursing homes and among clinicians, to local providers. I was on the phone this morning. Every Saturday morning, I'm on the phone with hundreds of physicians throughout Missouri. And just to echo what the governor said, the governor being a sheriff, Director Karsten being in law enforcement, I as a clinician, we're just so incredibly appreciative of our frontline responders now in our healthcare. We've been in those shoes, and we want to do everything we can to support you now. So the answer to your question is, as I told the physicians this morning, we want you to use the test for our state lab, which you can get back the next day, at your discretion, trusting your judgment on how best to work with patients, whether they be in nursing homes or in the hospital or in your care. So the answer is we want the locals to be doing more and more of that decision making using the framework the CDC has provided us.
All right, another question for you, Dr. Williams, from Kara Strickland from KY3. We had a question for today's briefing. Restaurants across the state have closed their dining room and limited to drive-through and pickup only. Is there still a health risk to the public if restaurant workers test positive for the virus?
Well, if someone tests positive for the virus, obviously we want them to isolate and those around them to be quarantined, as our guidelines say. I think that any time with social distancing that you can not engage in interaction, that's a good thing. We would ask all of our essential providers, those people who are working in grocery stores and doing takeout and that, to take their temperature, to make sure they're paying attention to their symptoms. If they become symptomatic, they need to seek medical attention. Call before you go. But just in the normal transactions, if they have not been diagnosed and they're not symptomatic, we would consider with our present guidance on that.
Okay, thank you. This next question is for Director Karsten. This question is from Madison from the Missourian. Governors in other states have reported that suppliers are prioritizing federal orders for PPE and not filling some states' orders as a result. Have suppliers canceled any of the orders for the state that has been placed for PPE?
As I've said earlier in the week, PPE is a precious commodity, and we know our partners at FEMA as well as the CDC to continue their attempts to provide PPE for our nation. In Missouri, we continue our attempts, and at this point, we are not aware of any orders for PPE that we've placed have been canceled.
Okay. All right, and Governor Parson, we have one question for you today. This is from the reporter Scott from KMOV. Many governors are now working with the Army Corps of Engineers to set up temporary hospitals in their states in anticipation of more patients. Can you explain why we aren't doing that in Missouri and why you are so sure that the state has enough hospital beds?
I'm not sure why you asked the question, but we've already answered that question publicly in press briefings. But we've been working with the Corps of Engineers for over a week with the National Guard, putting in temporary sites for bed locations across the state. So that's been part of the plan that we were talking about earlier. We're doing that on a daily basis, working with them, with our National Guard, with Seaman, with FEMA. So we're preparing that right now for different spots across the state. that we'll be able to have temporary facilities if we need that bed space. When the time comes when we need it, we're going to be prepared for that. I want to thank everybody for listening today. Just appreciate the Missourians. Keep up the faith, and thank you very much for having us here today. Thank you.